Morning, everyone. Sorry.
Which one, Treat? Righto.
A little less chilly than the last few days. Thanks, Simon.
Are you right? Everyone right?
Yep, thanks, Simon.
Okay, away we go. Thanks, everyone, for coming along this morning. Before we go to today's COVID update, I also want to give an update on the storms that we've seen overnight. And I understand that the BOM and the SES will be addressing media this morning as well. I can tell you it was a wild night in the Dandenongs, not much sleep last night, and one of our scared kids scrambling into bed. Vic SES has received more than 4,500 requests for assistance across the state in the last 24 hours to around 9 a.m. More than 1,700 of those have been cleared. There are around almost 245,000 homes that have been affected by power outages, with power companies working to restore power. Vic Emergency is currently showing 17 warnings for riverine flooding and 30 flood watch advice messages. There's also an evacuation notice for the low-lying areas of Traralgon, and there's a relief centre being set up at the basketball stadium. So I just want to thank, on behalf of all Victorians, the many thousands of SES members who have been out overnight and this morning supporting Victorians right across the state, to all of our emergency services. You are doing a brilliant job, so thank you for the work you are doing in the most difficult of circumstances. It was a wild, wild night last night. So on to COVID. There are 78 active cases of coronavirus in Victoria. There are 4 new locally acquired cases, 4 people from the same household. Public health teams are still investigating an acquisition source for these cases, and they were based in the northern suburbs. A number of exposure sites were listed online last night, some retail settings, and there's likely to be more to come. We're also working very closely with Queensland and New South Wales health authorities on the individuals who travelled into that state from Victoria, who will not appear in Victoria's numbers. Victoria was not able to speak to the couple yesterday for a case interview, but we will do so today. And I think it's important to note, if they were relocating, that is not a breach of directions here in Victoria, but we just don't know. So we'll have those discussions with those individuals today. But obviously, this is all concerning information, and Jerome will speak to these cases in a moment. But based on public health advice, we will continue to take those cautious next steps from 11:59 p.m. tonight. We've always said that when we could ease restrictions, based on that advice, we would. We also said yesterday, and we've been saying every single day, this is not over yet, and the risks of this virus will be a factor in our lives, in the long term and in the short term. So in the short, that means we are moving ahead, but we are on high alert. And the public health advice is very, very clear. We can only consider doing something like this based on continuing high test numbers, like the 23,679 tests that were recorded yesterday. That's a strong number, and I want to thank everyone who came out to be tested yesterday. But given the record numbers over the last week or so, I think that we can do better. That's the very thing that is giving us the clear picture to provide public health with the advice that it has in order for us to ease restrictions. So this absolutely must be maintained if we are to make those cautious next steps in a week's time. I can confirm that the easing of restrictions that we announced yesterday will proceed as planned from 11:59 p.m. tonight, with one small exception for Melbourne. Masks will continue to be required to be worn outdoors in all circumstances, and in a moment we'll hear from Professor Cheng to explain the reasons why we're making that small change to the easing of restrictions that we announced yesterday. Just finally, I'd like to remind people, if you have any symptoms, please go and get tested. We need to continue to see the testing numbers that we've seen over the last week or so. Isolate until you have a negative result and if you are eligible to be vaccinated, please book as soon as you can. So we'll hear next from Professor Cheng, and then we'll hear from Jerome, our COVID-19 commander, and then we're happy to answer any questions. Professor Cheng.
Thanks, Acting Premier. So in terms of the case numbers reported yesterday, 4 are reported in the community in Victoria, and then the 2 that were diagnosed in Queensland that have probably acquired infection in Victoria. So firstly, the 4 cases, they're in a household in Reservoir. As yet, we don't know where they've acquired infection from. They are not identified as close contacts, and none as yet has given a history of being at an exposure site. The first case, a man in his 80s, was tested on the 8th of June, and the result came through yesterday. 3 other members of the household, a woman in her 70s, a man in his 50s and a man in his 20s, tested positive yesterday as well. We've actually already tested several close contacts of these cases outside of the household, and they've all come back negative, but obviously will remain in quarantine. The 2 cases diagnosed in Queensland are a couple both in their 40s. They live in metropolitan Melbourne, and although we haven't managed to speak to them yet, the preliminary information we have was that they left home early on the 1st of June, travelled to New South Wales and then to the Sunshine Coast, arriving on the 5th of June. We understand from testing that's been performed that they are probably both late in their infection. They've tested positive, but their serology is also positive. We understand that the first case became symptomatic on the 3rd of June, so that would put that case as being infectious from about the time that they left home, so noting that they left early on the 1st of June. While we can't pinpoint the source of this infection, we're aware that one of the cases had checked in near the Craigieburn Central Shopping Centre on the 23rd of May. So at this stage, we're not sure if either of them might have been in the shopping centre or at exposure sites close by, but just noting that we have had 9 cases linked to that shopping centre to date. I think the fact that we've been able to identify a possible link to the Craigieburn shopping centre within hours of hearing about these cases, and even before being able to speak to these cases, really highlights the value that we have in QR codes, that we can interrogate that database very quickly. And I think this also reinforces the message we've been saying for several days now, that anyone who's been to the Craigieburn Central Shopping Centre who has any symptoms should get tested. In terms of the Delta variant outbreak in West Melbourne, I previously said they were working on 4 main theories: that the case transmitted or was infected by someone on the plane, that the case transmitted after his time in hotel quarantine, that the case transmitted to a staff member somewhere along their journey and then out to the community, or to the case transmitted to a hotel resident who's transmitted out to the community after their quarantine stay. In terms of the first possibility, as I mentioned, we have reviewed the testing of all the other 24 arrivals on the plane, and we're still reviewing some details about ground crew who may have been on the plane after that flight had exited. The flight crew, as I mentioned before, did not leave the plane. We now feel that the second possibility, that the case transmitted to someone else after they'd left hotel quarantine, we think that's probably unlikely, as he'd been correctly cleared with positive serology, and we now actually have some negative tests on his household members in the household that he was staying at after he left hotel quarantine. In terms of the last possibility, we've recontacted the 12 residents and tested most of them again, but noting that they'd all tested negative multiple times while in hotel quarantine, and in most cases had also been tested after their hotel quarantine period. So this leaves that third possibility of staff. We've cross-checked 268 staff at the IBIS and about 370 at the Holiday Inn, including healthcare workers, cleaners, hotel staff, VicPol, CQV and contractors who entered the hotel, and we've ensured that they've all had their surveillance tests and they're all negative. And we've also checked their addresses to make sure that they don't live anywhere near either of the 2 families. We've also continued to look upstream of the 2 families and have tested their contacts. And so while there are still a few tests that are still to come back, we're not coming up with a transmission path between this case in hotel quarantine and either of the families. So while it's the judgment of the public health team that we are in a position to ease restrictions, these new cases are really the strongest reminder that we are no means out of the woods yet. As I've said before, once we get down to small numbers, what happens next is very dependent on who those last cases are, what they do and how infectious they are. So over the last fortnight, there have been very limited opportunities for people to transmit infection during lockdown. And obviously what I am anxious about is that whoever gave infection to both these groups is identified quickly and doesn't have the opportunity to transmit to other people. That said, as we stand at the moment, all the risks are upstream. That at this stage, we don't think the Queensland cases have any exposure sites in Melbourne, and we've managed to quarantine and test the close contacts of the reservoir family, so their opportunity to spread further is limited. So in terms of the easing of restrictions, there's just one change because of these cases, that masks will continue to be mandatory in all settings outside the home in metropolitan Melbourne. We know that masks are effective, and it's just a small thing we can do to help prevent infection as everything else starts to move again. So depending on how things go in the next week, and as the last week's cases have shown, it really is very much a day-by-day proposition. We may need to hold at the current settings for a little longer, but obviously we'll have more to say on this as investigations proceed, and we keep an eye on things over the next few days. So in terms of what I'd like Victorians to do, if you're at all unwell, especially if you've been anywhere near any of the listed sites, please get tested as soon as possible and don't delay. Every hour matters for the contact traces. While we can leave home for any reason now, please, or from tomorrow, please follow the rules and don't move too far. Wear masks when out and about and check in with your phone wherever you go. And if you're eligible, which includes now anyone over the age of 40, please get vaccinated. I'll hand over now to Jerome.
Thank you, Alan, and good morning. As the Acting Premier said, 23,679 tests yesterday. That's now well over 600,000 tests since the start of this particular outbreak. And my thanks to everybody who's come out to get tested over the last 2.5 weeks. It is so important now that we maintain that testing discipline and that we have as much information as possible, particularly with these new community cases we've identified in the last 24 hours. We have a lot more work to do collectively as a community to really get to the bottom of the remaining ends of these outbreaks. 78 active cases of COVID in our community at this point in time. 3 of those individuals are in hospital. They're all ostensibly well, but they are in hospital for their own protection. We have cleared 1,500 primary close contacts in the last 24 hours. And we've reduced the number of our public exposure sites from over 350 to around 180. And again, the number of exposure sites will continue to go up and down as we identify further information, particularly with this new family in Reservoir and potentially the information from the family in Queensland. With regard to the City of Whittlesea outbreak, we have 32 cases in total. Some of them are expired. We have around 1,000 primary close contacts left in that outbreak. The last new mystery case identified for the City of Whittlesea was on the 31st of May. So we've had a fairly stable run of cases for City of Whittlesea, mainly existing primary close contacts. For Port Melbourne, we have 31 active cases in total. Last new case was identified on the 6th of June, last new mystery case on the 6th of June. We have 1,500 primary close contacts left. On the the aged care facility in Maidstone, we have 10 active cases. The last new case identified there was the 7th of June. We have around 1,000 primary close contacts currently isolating. I think particularly my thanks to the whole team working to support the aged care unit. There's a large group of people from our health services, VARC, care itself, and of course our own public health teams, providing a lot of support to that very sensitive location. It's an absolute priority for us to ensure we continue to support those residents as we complete that isolation period over the next week or so. And then in West Melbourne, the Delta case, we have 15 active cases. Again, the last new mystery case was identified on the 7th of June. We have around 1,400 primary close contacts currently isolating for that outbreak. So with regard to those outbreaks we've been talking about now for a few days, we are starting to see increasing stability in those outbreaks. We have a significant number of PCCs, primary close contacts, that are still isolating, but as I've said, we are now starting to reduce the overall number of primary close contacts. And again, as we've said before, my thanks to everybody who continues to isolate as a primary close contact. I know it's particularly challenging as we start to ease restrictions for the rest of Melbourne, that you're still being asked to maintain that isolation period. It is so important that we maintain it until the end of your isolation period, that we return a negative test and then are able to be cleared by our public health team. But my thanks for what you're doing. It's an important part of protecting the wider community. With regards to the new family of reservoir, Alan has given you the details. I'm pleased to note that one of the individuals who returned the first positive test only turned symptomatic on the 7th of June and was tested the day after and returned their test result yesterday. So their swiftness in acting has been so important for us to be able to identify that group quickly. And in that family unit, there were earlier tests taken as well. We have now identified a number of exposure sites that went up last night for reservoir in particular. I'd just like to read those out now to make sure that we really urge the community who've been to these exposure sites in particular, we really need you to come and get tested. They include the Marco Fine Food and Groceries in Reservoir, the BP Servo in Thomastown, the Coles at Bundura Square, and the Bunnings in Thomastown. Full details are on our website, including dates and times of exposure. Please, can I urge, if you've been to any of those locations in those times indicated, that you go and get tested today. It is so important now with a new cluster that we establish as much information as we can about what may have been happening there. Alan has also discussed our Queensland, the couple who moved to Queensland. Again, it highlights the real importance of that QR code discipline. We're able to identify literally within 2 hours of being advised of the names of those individuals, what their recorded movements were within Victoria and also apparently in New South Wales and Queensland. That's allowed us to identify at least that they have been to Craigieburn Shopping Centre or to that vicinity on the 23rd of May. As Alan has said, that's a particular interest to us. We have 9 positive cases associated with Craigieburn Central over the last couple of weeks. I would urge again, anybody who's been to Craigieburn Shopping Centre, please check again on the exposure dates. If you were there on the 23rd of May, if you've got any symptoms, I'd like you to go and get tested. It is so important that we try to establish any other leads that might be happening from that location. We have additional teams down there today, including a testing team who will support you to get tested, many other locations as well. In terms of testing, it's a pretty wild night. It's a pretty wild day as well. We're normally about 210 sites in operation. There are, as I walked up here today, 19 sites that are currently struggling with the weather. So we've got some tents flying around and we're doing our best to keep them open. But there are 19 sites that are currently suspended. Please check our website for full details for any sites that you may wish to go to. There are in particular a number of sites around Reservoir, and that would include the Reservoir Leisure Centre, La Trobe University at Bundura, the Newlands Senior Citizens Centre in Coburg, and the Respiratory Clinic in the High Street at Thomastown. So again, I'd urge you, if you've been in the reservoir area, anywhere on the exposure sites I've read out, please go and get tested today. That is our absolute priority, to run that particular outbreak to ground as much as we can. Finally, in terms of vaccination, another strong day of vaccinations across the state clinics yesterday. 48 state clinics, over 20,000 vaccinations, now well over 725,000 vaccinations done through our state centres over the last few months, and well over 1.5 million Victorians who now at least have had one dose. So again, my thanks to everybody for coming forward to get vaccinated. That is our long way out of this, and with a combination of getting tested when you're symptomatic, using QR codes wherever you go, and getting vaccinated, that is how we'll get through this winter and get out the other end. With that, the Acting Premier, Professor Cheng, and I will be glad to take any questions.
I just clarify with Ellen Cheng, if you wouldn't mind coming forward, in terms of your decision on maintaining masks in all settings. You say it's a day-by-day proposal. Is the main thing that you've got to look at to run this house cluster or house cases to ground, and then that could allow the mask rules being what was announced yesterday?
Yeah, look, I mean, I think masks are obviously a very small impulse. We've all got them, and all we need to do is put them on, and they are effective. I think, you know, we're still in pretty early days in looking into this cluster in Reservoir. I think we would be much more comfortable if we're able to identify a link that would link it to another cluster, and then therefore that would resolve that mystery, as it were.
Alan, what makes you comfortable opening with these 4 new cases when we don't know where they come from? Is it a possibility that we could shut back down if we can't find a link with these 4 new cases?
Look, I think we're in general, so I've talked about sort of upstream and downstream risks. I think in this situation, obviously we do have concerns about these, but those concerns are more upstream risks. So where did they get infection from, rather than the possibility that they will continue to transmit on. I think one thing we were very keen to make sure that we were able to clear yesterday by testing the other people that had been in the house was to make sure that there weren't any links to sensitive settings like schools or disability settings or public housing or anything like that.
And are they all Delta cases?
We don't know at this stage. That genomics will be done today.
What are their conditions, particularly the eldest gentleman?
Sorry?
What are their conditions, particularly the eldest gentleman?
I understand that they're not in hospital and they're well. I don't know, they're symptomatic but not severely unwell.
Do any of the 4 new cases have any links to disability services?
I understand that one of them is the recipient of a disability pension and one of them provides care, one of the to someone else who has disability. One of the people that we're very keen to make sure that we had results on were obviously the people that they had visited, so to provide care for, and they were able to be cleared. But obviously they will remain in quarantine.
Just in terms of genomics, we heard from Jeanette Young earlier today that the case that travelled up to Queensland may not have enough viral load or much of a sample to get genomics. Is that a concern, or do you think there may be enough to be able to investigate any links that you need to shut off?
I think it would be, so obviously we haven't even spoken to the cases. I think that interview might be progressing at the moment, and actually we're sharing information. There's a meeting that's happening as we speak with New South Wales and Queensland. I think if, obviously the lab in Queensland will be doing similar work to what the Doherty had been doing in Melbourne, and trying to get as much information as they can out of it. Sometimes that information isn't enough to say, you know, this is definitely linked to a particular other strain, but might be just enough to say it's the Kappa or the Delta strain, and obviously that information in itself would be useful.
Just back on the family of 4, do you have any working theories as to how they may have possibly contracted the virus?
Not at this stage. They're in Reservoir, which is sort of halfway between the city and Whittlesea, so obviously there's that potential link, but we're looking into all possibilities.
And if that jumps to more people who are in the disability space, either receiving a pension or other people caring for disabled people, are you going to toughen restrictions?
So not at this stage. So I'll probably make the point that they don't work in a disability facility. They provide care to people that are on a disability pension in their own house. So that's a slightly different situation to being in a sensitive setting, I think.
Sorry, have any of them been vaccinated?
I don't have that information as yet.
Is it, Mr Molino, in terms of Professor Cheng's advice to strengthen these mask rules for another day, did the government hesitate on that at all, or was the advice provided and the decision made?
Yeah, the advice was provided, Simon, and the appropriate thing is to respond and accept that advice, and that's why we're here before you today saying the public health advice is comfortable that the easing of restrictions that we talked through yesterday that come into effect 11:59 tonight, all of those will proceed. The public health advice is that they can, subject to one small adjustment, which is in regards to the wearing of face masks outdoors. And I've said a number of times, we don't have the luxury of picking and choosing the public health advice that we like or that we don't like, and then not go ahead with elements of it. The clear advice from the public health team, from Professor Cheng, Professor Sutton, is that we need to continue with the wearing of masks outdoors. It's a little inconvenient, but it's an easy thing to do. We're used to it, we know that it works, and as we come out of this period of lockdown, whilst we're driving these new cases to ground, I think it's a logical and common sense step to take. And it allows all of the businesses that we've outlined yesterday that will open, they can all open. The movement of people, that can all happen. Students back at school, that can all happen. It's a small price to pay to make sure that we can proceed with this careful easing out of lockdown with the continuation of this restriction.
Can I just ask, how come all the states are quite different in their approaches, or at least there are big differences, when each government is taking medical advice from medical officers who all talk to each other, and each of the states agreed in National Cabinet to pursue the same target, the same thing? So how come there are differences?
Because the nature of each outbreak is different, Alan. You know, there's national agreement in terms of aggressive suppression. There's national agreement in terms of infection prevention, protection controls that we have in hotel quarantine. So there are a number of things that we engage with and agree at a national level, but it's a reflection that every single outbreak is different. Now, we've had outbreaks here in Melbourne that have been particularly localised and contained, and therefore did not lead to a period of more broader lockdowns. But you look at this particular outbreak that we're dealing with, originated in a hotel breach in South Australia. It spread very widely. So the number of primary close contacts, hundreds and hundreds of exposure sites in regional Victoria and metropolitan Melbourne meant that the public health advice was that we needed to have broad settings in terms of a period of lockdown and in terms of restrictions. So every outbreak is different, and that's why the public health advice, whether it's in WA, New South Wales, South Australia, Queensland, here in Victoria, the public health advice is dealing with the situation on the ground, the variant of concern.
Are you saying that you would like to do localised lockdowns like New South Wales has been doing, but you can't because of...
No, that's absolutely not what I'm saying, Alan. I'm actually talking about outbreaks here in Melbourne. The Black Rock outbreak didn't lead to broader sets of settings of lockdowns because it was contained locally. So it depends on the situation that you find yourself. In this current outbreak, the breadth of exposure sites in regional Victoria, metropolitan Melbourne, the sheer number of primary close contacts, the appropriate advice from public health and accepted by government was that we needed a period of lockdown and then careful easing back of restrictions. In Black Rock, in Victoria, in other local outbreaks in Victoria, it hasn't led to that public health advice because it was contained in a small area, and we could run it to ground very quickly.
On restrictions, can Melburnians with properties in regional Victoria travel there to assess damage or fix damage from this storm?
So I might get Jerome if you've got some advice on that, but we take a common sense approach, or Professor Cheng on that matter. We take a common sense approach. This is a statewide emergency. I started off talking about the storms, the floods. If there is an emergency requirement to attend a property, then that can happen. But I'll come back to you in terms of the exact details and circumstances. But we do acknowledge that in an emergency scenario, obviously common sense applies.
When's the Premier indicated he'll return to work and at what capacity? I'm waiting for our Daily Mail.
Good to meet you. In terms of when the Premier will be back, he put out a statement a little while ago. He's meeting with his doctors this week, and based on that advice from his doctors, he'll be able to indicate at what point he'll be able to return back to work as Premier. So I'm not his doctor. I'm in regular contact with Dan, but it'll be his doctor's advice, meeting with him this week, and we'll have a better sense of when in June he'll be back.
Well, he's saying...
Based on that decision to keep masks mandatory outdoors, what medical evidence do we have that this stops transmission when you're outdoors?
Sure. I'll hand over to Professor Cheng to answer that question.
So there's now pretty good evidence there was some careful analyses done of sort of the period between last year between stage 3 with mandatory masks and stage 4, and it could be clearly shown that there was a reduction in transmission when mandatory masks were in place. I'm a hospital doctor, and we always talk to people about medication, and I always make the point to patients that, you know, the medication's no good when it's sitting in the jar. You need to actually take it for it to work, and it's the same with masks. It isn't effective. It's sitting in your pocket. It needs to be on your face to be effective.
So you're particularly worried about transmission outdoors?
Given the numbers that we have currently, what's the risk profile difference between us not wearing masks outside, as was indicated yesterday, and now having to wear them for another week?
Look, I think there's probably a couple of things to that. So, firstly, that you know, people, you know, as they move between inside and outside, there is that transition, and we certainly know that there have been transmissions of, you know, from relatively brief contact from people that don't know each other, that haven't been in the same place. So as people move from outdoors to indoors, we want them to be wearing that mask. I think it's also a reminder to everyone that we do have this, you know, we do have active cases in the community, and we want to stop. We want to stop every last transmission. And then, you know, that judgment about how far you are from someone else, you know, that's a fairly inexact science to work out exactly how far you are from someone. So to have a mask in that situation when there are active cases about, and hopefully for not too much longer, I think is still one of the important things.
Can I clarify?
20 times less likely to transmit outdoors.
That's true. Yeah.
So what does a mask do?
Yeah, so 20 times less likely doesn't mean that it's zero. There is still a risk, and there have been transmissions documented outdoors.
And are you worried about the 25k limit with possible new exposure sites coming up because of those 4 cases?
Look, I'm always concerned about, you know, in the situation that we have at the moment, I'm certainly concerned about the spread of infection. We've made the judgment that we can ease into these restrictions, but clearly the public health team will be, and the contact tracers will have to be very closely across all the cases as they appear. And we need the public to play their part. If you're at all unwell, please come forward for testing so that we can identify cases as they occur, if they occur.
And I know that you've explained it before, but there are people that are asking questions around the restrictions this time round. What is the worry around households, and why are you okay to have 100 or 50 people in a pub, but you can't have anyone at all to your house?
So it is around the sort of controls in you know, in a private household setting. People can spend a lot more time. They're often a lot more close to each other. They, you know, definitely probably wouldn't be wearing masks less likely to be wearing masks in an indoor setting. There's not the cleaning and all the other things that are done, as opposed to public outdoor settings where they have COVID-safe plans and QR codes and other things that would help us jump on infection a lot more quickly.
Sorry, I just have a couple of questions on restrictions. Firstly, if you have a business at home, are you allowed to operate that business from home, say if you like doing massage or beauty at home?
Yeah, I have to get the exact wording for you, but I understand that if there is a separate entrance for the business, that's okay, but I have to get back to you on the exact wording.
And just on clinical group exercise classes at a physio or a physiologist, are they allowed?
I'll have to get back to you on that one.
Just when you said you're allowed to do, operate a business at home, there's a lot of people that do like personal training in their garage with the separate entrance down a driveway, for example. Is that allowed to occur?
I believe so, but again, I might just have to check the wording, the exact wording to make sure.
Can you give us an update on elective surgery, where discussions are at for resuming in Melbourne?
So I understand that there will be a change in that roadmap for hospital settings. I have to get back to you on the exact date, but I understand that it will change soon.
Do you have that, James? Has that come to government yet?
I don't, so I'm come back.
What is the big concern with elective surgery if you've got 50 people in a restaurant, but elective surgery can't resume?
It's going to change very soon.
How soon? How soon?
Yeah, but I haven't got that information, but I do understand.
Can we give any level of reassurance to people who have booked in elective surgery for months?
So elective surgery will resume soon. It probably won't be on the weekend, but it may well be early next week. I think,
Elective surgery waiting lists obviously blew out massively last year because they were on hold for a couple of months. There's been people on the waiting list for years. And, you know, we talk about elective surgery, but it's not an election for a lot of people. They actually desperately need it. Has there been any consideration with any of these lockdowns when we have only so few cases to not completely ban elective surgery?
I probably need to defer to someone else about the exact elective surgery settings, but it is part of. There is a roadmap for hospitals, and additional precautions are taken when there are active cases in the community. I think, you know, we do understand that, and we really certainly do sympathise with the people that are waiting for elective surgery, but equally having a case in a hospital that's, that comes in undetected is also a major disruption.
All of 1A has been vaccinated. Jerome Weimar said a couple of weeks ago that all of 1A had been, or everyone who needed to be vaccinated in 1A has been. About 80 to 85% of 1B has been vaccinated. Given the high vaccination uptake in public hospitals, you know, even the private settings, moving forward, can we have a setting where elective surgery isn't necessarily temporarily banned?
Look, I think it's something we'd always look at, and that's part of the department's hospitals, the health and wellbeing division. I think it's important to say, though, that it isn't just about, you know, hospitals don't have just staff in them, and there are patients as well, and who are also at risk. And hospitals are places where, you know, we worry very much about, you know, people coming in that might have infection. The other thing to say is that that vaccination isn't, you know, isn't a magic bullet. It, you know, we certainly have seen people who are vaccinated get infected, and they can continue to transmit. It is better. They have a lower risk of getting infected. If they get infected, they have a lower risk of transmitting, but it's not an absolute bulletproof
But we
protection.
treat people with COVID in hospitals. There are people who go into emergency departments or who have regular appointments who may not know that they have COVID, you know, entering into those facilities. I guess my point is, you know, going forward, moving forward, will you consider that as a top priority to, you know, reconsider in terms of, you know, further, you know, in terms of future restrictions, I guess?
I think we're always looking at all the settings in hospitals and aged care for that matter, and I think that would be one that we would look at.
What about Molino? Oh, you go, Alan.
Can I just ask, just as sort of Mr. Molino, sort of further on that, you were talking in your opening statement about the long term. Can you give us a sense of what you think that looks like, particularly between now and when we're fully vaccinated, or enough of Victorians are vaccinated?
Alan, it's what I've been saying very regularly. We are not out of this pandemic until we're at a position where we've successfully rolled out the Commonwealth's vaccine program, and we've got purpose-built quarantine facilities to deal with our highest risk individuals. We know from advice, from what's happening right around the world, this pandemic will be with us for some time yet. So we've got short-term, dealing with it at a short-term level, which is what we're talking about today in terms of the easing of restrictions, the continuation of the wearing of masks outdoors. But there's also the long-term challenge that we have. And getting through that period requires the rollout of the vaccine, and purpose-built quarantine facilities.
But they say that you need about 80% of the population vaccinated, and that's quite a long way off. It's at least 6 months, possibly 12 months away. What happens in the meantime in Victoria? Are we facing a series of continuing lockdowns like this one if there are further outbreaks?
Professor Cheng went to that question a few days ago. Every jump in the percentage of our population that is vaccinated, either fully vaccinated or at least having their first dose, is a step forward. So 10% is better than 2%, 20% is better than 10%, 50% of the population is better than where we are right now. At the moment, 2 to 3% of our population is fully vaccinated, and around less than a quarter have received their first dose. But there's no doubt that, yes, you want to get to that high level. There's no magic number, as Professor Cheng talked about a few days ago, but the more people you get vaccinated, the more comfort public health have in the advice that they give to government in terms of how we respond to an outbreak. If we're in a position now where the population was vaccinated at a level where we should be, you look at other jurisdictions around the world, well over half of their population fully vaccinated. If we're in that position, if we had purpose-built facilities, so individuals with the Kappa or the Delta variant of the virus, which is 50% more infectious, if they were in a purpose-built facility, if we had that level of vaccination in our community, then we may well not have the public health advice in terms of the lockdown we are just moving out of as of midnight tonight.
Whose fault is it that we are so far behind on vaccination?
Well, it's a matter of fact, Alan, that the Commonwealth vaccine program is a federal responsibility. The federal government is responsible for the supply of the vaccine. We're getting it into people's arms at a very fast rate, 93% utilisation. So as soon as we're getting the vaccine, we're putting it into people's arms because we know that this is a race. 40% of vaccinations in our country are happening here in Victoria. So Victorians want to get vaccinated. We want to increase the eligibility. All of it comes down to supply. Now, there's global supply reasons as to why it's been delayed, but it is a fact that it has been delayed.
There was
Your message to the Mayor of Moiree in New South Wales, who's fuming that a person has travelled from Victoria while Metro Melbourne was under stay-at-home restrictions, gone through New South Wales up into Queensland. Now, I know you said before that they may be under an exemption, but what's your message to the fact that someone's been able to travel to another state in breach of the lockdown?
Sure, and I might get Jerome to add to my comments in a second. It's really important that we interview this couple. As I said at the outset, if they were relocating, that is not a breach of directions in Victoria. There may well be things that they should have done in Queensland. I don't yet have the answer to that, Simon, and that is a question for Queensland authorities. But I just want to make it clear that we do not know yet. We need to interview this couple. There's reasons why we've not yet been able to interview this couple, and I'll ask Jerome to add to my comments. But I want to be clear, if a relocation is not a breach of directions.
But can you, maybe for Jerome, if you are relocating into another state, can you stop through stops in New South Wales?
Okay, I might go to Jerome in terms of his engagement with both Queensland and New South Wales Health.
Thanks, Simon. So with regard to what we know at this point in time, so certainly it is absolutely permissible under our directions if people are relocating interstate to leave Victoria under those directions. I have no knowledge. We have not been able to speak to the couple concerned. Obviously, our primary concern is for their welfare. We know they're being well looked after by Queensland Health. Both Queensland Health and New South Wales Health are discussing things with them at the moment, and my team is talking to New South Wales and Queensland right now to share whatever information is coming out of those early interviews. So clearly anybody who intends to relocate has to also then be compliant with restrictions and directions in other states. Clearly Queensland has a set of border directions. New South Wales will have its own requirements for people travelling to or through the state. And what I would say is two other things. One is that the fact that we've seen potentially and most likely the virus acquired here in Victoria and potentially transmitted through New South Wales to Queensland is why we put the stay-at-home directions in place in the first time. We do not want to see the virus move around when the focus is to get it all under control and to make sure we've got everybody safely locked away. And secondly, it is really important, of course, that anybody who is travelling, who is permitted to travel under those exemptions, still maintains that COVID-safe behaviour, particularly around getting tested when they're symptomatic and making sure they do the right things.
Sorry, Jeanette Young said that the couple weren't exempt from travelling from Melbourne to Queensland. She also said that they were at the end of their infectious period and that they were probably most infectious in Victoria and New South Wales. Given, I guess, given that, and given we haven't been able to still speak to that couple, how concerning is that?
Oh, we're very concerned about this, and the focus for the team last night and this morning is to get as much information as possible about this couple, to understand their movements, to understand potential source of acquisition. Of course, we want to link it to one of the existing clusters that we know about, and right now we have no information, next to no information to run on. So we're all working together with the other authorities to do that. We will swing our full contact tracing tracing and acquisition work into action. The only thing we have to go on now is a relatively small number of QR code registrations. That's why, again, we are exploring again Craigieburn. That's why, again, we're urging people in the Craigieburn shopping centre area to come forward and get tested again, because that is still one of our hotspots that we've been dealing with for a number of weeks now. But look, it's an absolute priority for us today, that and Reservoir, to get as much information as we can, so we can be confident as to how we go forward.
Is there any reason why?
I'll come back.
Sorry, is there any reason why you haven't been able to contact that couple yet,
Well,
necessarily going into?
Yeah, with due respect to them and everybody else, they're with Queensland Health. Queensland Police stepped in a bit last night as well. Obviously, we want to make sure we have a coordinated approach to getting information from them. We're all after the same thing. So there's a reasonable discussion between Queensland, New South Wales, and ourselves to get the right information. I'm going to move on now.
There was a wastewater detection in Bendigo yesterday. Are you able to talk us through that and how concerned you are about it? Or?
Yeah, look, we saw another minor wastewater detection in Bendigo yesterday. So we've reviewed the number of primary close contacts that are still within that area. We have got some day 13 tests coming up. We're doing repeat sampling again today to see if there's anything else coming up, and if there's more to be concerned about, we'll alert it. I'll come back to your question around.
And Jerome, so they're Victorian citizens, are they? The people that travel to Queensland?
To be honest, I don't know. I know they have a residence in Melton. I know they travelled from that residence at early in the hours of the 1st of June. That's about all the information we have at this point in time.
Does it normally take this long to get a hold of Victorians?
Look, this is a unique case. We've not seen in the last 16 months or so an example of people leaving a lockdown environment and moving interstate and then being positive in the other state. They are now ultimately in the supervision and charge of Queensland Health. I absolutely understand and respect and support, and I would do exactly the same thing if I was in Queensland Health shoes or New South Wales shoes. They are obviously concerned about active exposure areas in their location. We'll work with them to get the information. I'm sure we've had more information come out in the hour and a half we've been here, and we'll work with that and go from there.
Sure, and on that, I understand New South Wales. Just on that, I understand New South Wales Health have said this, or the government have said this morning that potentially, if a breach is found with this case, that they could be fined in 3 states. Is that?
Yeah, and again, Simon, it depends on the circumstances. So I'm not going to speculate. So there are a number of scenarios that could play out here. And I think with all due respect to the individuals concerned, there's a lot of information that we're all trying to get from them about their movements. Our first priority is public health, to make sure we understand any exposure sites and any acquisition we can get. I'm very confident that information will start to flow very shortly if it hasn't flowed already. If there is further enforcement action that's necessary, we'll take due course, of course.
So you're confident that there's no exposure sites linked to that family in Victoria?
Well, based on what I know at the moment. So, again, all we have at the moment, as Alan has said, is some indications about what the CT values are of this particular first case. We've got a lot more information to work through. I am calling out Craigieburn only because it's come up again. Here we have another positive case with an exposure to the Craigieburn area. It could be a furphy, but I think at this point in time, I think with abundance of caution, I'm very keen to see that people are tested in that Craigieburn shopping centre area.
Might be one for you, might be one for the Deputy Cho, but our missing links, where are we at with all those cases?
So we're continuing to investigate. Obviously, the focus for us today and over the last 12 hours or so is very keen to establish the link to the reservoir, the active new reservoir unknown cluster, and how that connects in. And there's a number of leads that we're working through. Ditto with the Queensland couple to understand again as much information as we can to connect them back in again. We have the third priority is the case that Alan's gone through about the source of acquisition from the arriving traveller from Sri Lanka into the West Melbourne cluster, and quite how that route worked through. And some fantastic work's been done in the last day and a half around that. We have still some more narrow leads to come through. And then really the last remaining link of significance to us is the aged care link into one of the other 2 clusters. We know the aged care cluster is a Kappa cluster, so somehow or other it's connected to Port Melbourne and City of Whittlesea. Again, given the huge testing numbers we're seeing over the last few weeks, ultimately these leads will all come to the surface through people coming forward for symptomatic testing, and that's what we can all do. If you've got symptoms, get tested. That's how we found the reservoir cluster last night, and that's how we'll find any other clusters that are out there.
Jerome, 2 days ago we were told that 2 people on the same floor as that man who was staying at the Novotel Ibis didn't have their days 17 and 20 tests.
Yep.
Has that been fixed up now? Have
Yes,
they-
so all the residents who were on the IBIS floor, there were 12 residents on the IBIS floor. From memory, I believe one is now international overseas, left immediately. I believe there are 11 still within Australia. 10 of those have now all been contacted. I think 9 have all been tested. We have negative results for. There's still a couple of test results to come through.
So what about that remaining person?
The one remaining person is overseas.
Briefly.
They left immediately. They're a maritime worker. They left hotel quarantine straight into a ship and out.
But 12 people, you said that 10.
So 12, but there was one other person, I think, who's interstate, who we're still trying to track down.
We briefly had concerns that there might have been outdoor transmission at the Brighton Hotel. Has there been any cases of outdoor transmission with, these particular clusters?
No. So we talked about the Brighton Beach Hotel a number of days ago now, I think the end of last week. So as we know from, I think our press conference last Friday, the positive case associated with the Brighton Beach Hotel and the Anglesey exposure sites, that was a false positive. We declared that, I think, a day after the false positive result came through. All those exposure sites have been cleared. We don't have any other exposures at Brighton Beach Hotel.
And given the wild weather, are there any testing stations that have been affected or any vaccination sites that have been affected?
Yes, thank you. So with regard to wild weather, so there are 19 testing stations out of 210 that are currently suspended, and our teams are working to stabilise those, and if we can get them back up again, we will. And again, details are on our website. So if you are getting tested today, and I hope you are, if you're symptomatic, then please do check the website as per normal. Vaccination stations, I believe, are all up and running at this point in time. And again, we had a slightly quieter day for the last few days, so I'd encourage anybody who's eligible to be vaccinated to please come forward. And finally, I think the earlier question around emergency response generally. We contacted all of our primary close contacts who are isolating last night who might be in flood risk areas or storm risk areas, gave them advice on procedures to follow should they need to be evacuated and how to do that safely. We'll continue, of course, to liaise with anybody who's in that situation, and particularly in a vulnerable location as the weather takes hold. And for people checking who have a need to check property in regional Victoria, there's specific guidance on our website, and I'll make sure that's in the show advice this afternoon.
3 quick questions for Mr. Molino.
Sorry, can I just ask Jerome one before you're there? Like businesses in regional Victoria, are your regional testing sites now asking for licences?
They should be, yes. I'll go and confirm that separately. But certainly as we've said before, and we certainly had this question come up a few days ago. Again, the reasons to leave home in Metro Melbourne do include vaccination and getting tested, but they do not give you the authorisation to go to regional Victoria for those purposes.
And you said there'd been no evidence of outdoor transmission with this outbreak. Had there been any evidence of outdoor transmission with the previous Blackrock outbreak or the lockdown that we had over the Valentine's Day weekend?
I'd need to go back and check my records, but certainly Blackrock was primarily, again, an indoor transmission event at a restaurant. The Holiday Inn event in February, again, was primarily indoor household transmission and one significant event in a private venue.
So you're particularly worried about outdoor transmission?
No, I think where we've been really concerned over this outbreak over the last 2 weeks, and we've discussed it in this room a number of times, is around that exposure site transmission, casual contact transmission. We've seen 9 cases now confirmed at Craigieburn. I think we've seen something like 10 or 12 cases confirmed across the entire outbreak so far. So it's a significant vector in this outbreak. And to go to the earlier questions, nowhere in Australia have we seen these variants before out in the community and doing community transmission. We're the only state that's had to wrangle these two to the ground, and certainly I think both of them are heading in a good direction, but we've got more work to do as we see these new cases come forward.
Professor Sutton had recently said that he had, briefly considered maybe shutting down Craigieburn Central, just given the number of exposure sites there, but then he decided against it, obviously, because people need to go to the supermarket and need to go there. Have you considered sort of shutting down Craigieburn Central or Epping Plaza or those hotspot shopping centres?
Yeah, no, certainly not in the last 24 hours, and so I hope, Brett's absolutely right. I think we always, this information, this evidence comes in progressively. There's no sort of one overnight reveal. The additional information we have overnight, particularly associated with a potential link for the Queensland couple with Craigieburn, again, of course, it gives us more cause for concern. So the call out is there. It is a very high bar indeed for us then to move to formally closing an entire shopping centre. So we would need to see real evidence of transmission, real evidence of uncontrolled transmission in that environment. We certainly don't have that, but we do have concerns when we see this many cases clustering around one location.
One for James and Alan.
Sorry, Jerome, just out of curiosity, do we have a percentage of how many people that are local COVID cases have caught the virus while they were outside?
I don't. Well, depends how you define outside. To be a bit pedantic, but certainly if I look at exposure site, people picked up at exposure sites, and again they've been small shops we've talked about previously. We talked about the Telstra shop. We've talked about Craigieburn Shopping Centre, Epping Plaza, those kind of locations. We have at least, I think by my count, 10 or 11 cases who have contracted COVID through that exposure site.
They're all indoors.
They're all indoors of a type, yeah.
But do we have any that have been outdoors?
Not that I've confirmed, no.
So we have no cases of people picking up the virus outdoors.
No, we have no evidence that we've seen yet in this particular outbreak or the most recent ones we've dealt with of outdoor transmission.
So why are we being made to wear face masks outdoors?
Because we're in this environment where we still have undetected community transmission active in our community. We've done collectively as Victorians a power of work over the last 2 and a bit weeks to both under the 2 weeks under the lockdown and previously to get as much information as possible to isolate over 8,000 primary close contacts at one point, to hold that down, to hold down the head of this particular outbreak to the very low numbers we're seeing at the moment. But the evidence overnight is we've still got community transmission happening that we're not currently aware of.
And that was in a household.
And that was in a household,
so
absolutely.
There's no current evidence in the most recent outbreaks in Melbourne that there's been transmission of the virus outdoors.
Correct.
Mr.
Just going to the acting Premier.
You go, Bridge.
A number of MPs have been spotted without masks today, indoors and outdoors. Should they be leading by example?
I'm not aware of that, but absolutely they should. You know, the rules are clear and the rules are there for everyone. And we've made it quite clear that based on public health advice, we need to continue wearing our masks outdoors. We need to wear them indoors. There are very few exceptions to that rule.
Is there a double standard, though? If your MPs are not following the rules that you're asking other Victorians to follow, isn't that a double standard?
Simon, you're putting that to me. I haven't seen that. I was in the Parliament Parliament sitting, of course. I was in the Parliament for question time yesterday. Everyone that I saw was wearing a mask inside the chamber and outside the chamber. So what I observed yesterday was everyone was wearing the mask. And from this press conference, I'll head into Parliament. I asked the question, what's my view if people aren't doing that? Well, people need to do the right thing, and these rules apply to everybody. Well,
according to Richard Willingham from the ABC, there is a minister and a staff that he's seen inside an office without masks, and they were having lunch during the meeting. So is that maybe the explanation?
Well, again, I can't speculate on what other people are speculating about. If you're eating and drinking, you can't do that with a mask on, and that's been a pretty common sense approach for the wearing of masks the whole way through.
And my other question was some prominent Melbourne figures, including Matt Gadinsky, a bunch of live music entertainment and venues have now written a letter to Brett Sutton concerned about the speed of which that we are coming out of lockdown. These are some of the most prominent venues, people that your government deals with. Will they get a fair hearing with Brett Sutton, and can the speed of coming out of lockdown be reviewed?
Well, look, we endeavour to engage, and public health does engage with industry, no matter what sector of the economy, organisations, health settings, community settings, sporting clubs, both community and at the elite level. So there's a high level of engagement. We understand that a period of lockdown, a period where we have restrictions. These are difficult, and it's why we announced the business support package. We'll engage with the live music industry, the hospitality industry, the settings that we can move to from midnight tonight, from 11:59 tonight, means that we can have hospitality, live music venues open at certain density limits and caps. We've further eased that for regional Victoria, and that sets a signal to the live music industry and hospitality industry. We want to get through this period as quickly as we can, but we've got to do it safely.
You mentioned you were in close contact with the Premier. Are you able to say what sort of input he had, not only to the lockdown we're about to end, but the road out of the lockdown, and when also we might, as Victorians, see his face again? Sure.
Look, I appreciate the question. I can only give the answer that I've given many times. On the big issues, I have regular discussions with Dan on the day-to-day business of government, whether it's the budget, whether it's responding to the COVID crisis, whether it's the day-to-day business of government. We want him focused on his recovery, but on the big issues, of course, I talk with Dan on a regular basis. Based on his doctor's advice, we'll have a better sense soon in terms of when Dan will be back.
Ambulance Victoria answered a series of the opposition's questions a few days ago. Commissioner Shane Patton also answered the police-related aspects. There are, I think, 2 unanswered questions. Do you think Ambulance Victoria and Victoria Police's response puts the opposition's questions to bed? And does the government have plans to answer the unanswered questions?
You're not joining the conspiracy nutters, are you, Samaya? Look, I think I dealt with this question last time I was asked. You know, it is a very poor reflection on the opposition and on the Liberal Party that they are focused on what are just bizarre conspiracy theories. I think it's a poor reflection on the Liberal Party, on the Leader of the Opposition. The fact that they are doubling down today on these nutbag conspiracy theorists is, I think, a great disappointment to the people of Victoria. You know, we are dealing with a pandemic. We are dealing with an extraordinary storm event overnight. You know, we need to respond maturely and appropriately, and I don't think the people of Victoria are seeing that from the Liberal Party. This is clearly sanctioned by the Leader of the Opposition, and I think that is a disgrace.
I know Drew Owen flagged that there was some updated advice online, but would there be any changes to home visits in light of what happened last night? People's homes are damaged, they might need to stay somewhere else.
So there's obviously emergency arrangements for people that have their home is damaged, for people to support family that might be impacted by the storms. I'll come back to you in terms of the exact scenarios, but we take an absolute common sense approach. We've dealt with a wild weather event overnight, thousands and thousands of call-outs. We will deal with this in a common sense way in terms of people being able to support perhaps parents who have their houses damaged. But I'll come back to you in terms of the detail.
Can you please just clarify 2 things re restrictions? First, dance studios. We heard a lot about gyms yesterday, but why are they still closed, particularly for kids?
I'll ask Professor Cheng to go to why those sorts of higher risk settings remain closed, whether it's dance studios, amusement parks, gyms, nightclubs. There's a reason that they are a higher risk setting than other venues and other businesses. We've stepped in and provide that top-up business support for the duration of this week or this coming week, in which they'll continue to be locked down. But in terms of the why for dance studios, I'll ask Professor
Just one for you,
Cheng.
Acting Premier, just following on from that, if that's all right. A lot of gym owners have come to us saying that they're struggling to pay their rent and put food on the table. Even though you announced there would be extra assistance yesterday, they say that's not going to cover the bills. Do you think that it's unfair keeping them in limbo for a week with no guarantee around exactly when gyms are going to reopen?
Look, I understand how difficult this is, whether you operate a dance studio or a gym, or you're a beauty salon this week in Melbourne and customers need to continue to wear a mask. We understand that impact, and that's why we have provided additional support for those businesses that, based on public health, need to remain closed this week. In terms of the federal government support, income support, that ceases at the end of this lockdown. So from 11:59 p.m, the advice from the national CMO to the federal government is that Melbourne is no longer a hotspot. Therefore, that income support is no longer provided in Victoria. Now, we tried to get them to reconsider that. Our State Treasurer, Tim Pallas, spoke to Josh Frydenberg to see if that would be reconsidered. My understanding is the Commonwealth aren't going to reconsider the timing or the nature of their income support. That's a matter for them. But we understand that this is a difficulty this week for a few thousand businesses across Melbourne who will need to continue to be closed, and that's why we're providing that support. But I might ask Professor Cheng to talk to why these settings are higher risk and we need to have them closed this week.
So we had a similar situation last year where when we're trying to open up, we made the judgment that it's the lower risk settings that we want to open up first, and particularly at the moment when we have active cases around. So what defines high risk settings? It's the same as it always has during the pandemic. It's time, place, people and space. So about the number of people, what they're doing. So when there's exercise and heavy breathing and so on, that is something that's known to propagate the virus. And then the number of settings, ventilation and those other things. So that defines a higher risk setting. So we then need to draw a line somewhere and then say these ones are lower risk, they can open first, and then the higher risk ones need to wait a little longer.
And where do sports stadiums fit in with that? I ask because the AFL has a couple of games scheduled in Melbourne, not this weekend, but the following weekend. One of them is in regional Victoria at Cardinia Park. I'll ask the acting Premier about that too, but where does that sit for you?
So for the AFL, they have special protocols. I don't know exactly off the top of my head what they have, but they include testing of players and so on. And obviously it depends on where the players have been, which I can't quite recall, but if they've been not in Melbourne, then that would define that as being lower risk.
Professor Cheng.
Can I just ask the acting Premier on that? What are the chances of these games going ahead, one? And two, what are the chances of there being a crowd there?
I appreciate the question, and all footy fans I know are anxious for the answer. I simply can't give a definitive answer on the question of the games and what that might mean for crowds. What I can say is that throughout this pandemic there's been excellent engagement between the AFL and our public health team. They've done a brilliant job in terms of their COVID safe plans. Just a few weeks ago we saw and we're enjoying very large crowds at our AFL games. In terms of when we will see a return to that, that'll be based on engagement that's happening right now between public health, the AFL and other elite sport leagues, and we'll have more to say in coming days.
But economically, would the AFL want that game to go ahead without crowds here in Melbourne, or will we have to wait for crowds to come back for that to happen?
Oh well, that would be obviously a decision of the AFL in terms of what are the public health settings here in Melbourne and Victoria compared to other parts of the country, and then the league will make its own decisions. But in terms of what the next few weeks mean, both in terms of games being played and crowds at those venues, that is subject to discussions between the AFL and public health right now.
Can I just ask Professor Cheng a question with his ATAGI hat on, if that's okay, please? Thank you. With the AstraZeneca and obviously the very, very rare blood clotting disorder, is there any link between, I guess, surgeries and anaesthesia and blood clotting caused by the AstraZeneca?
Not as far as I'm aware. I think it's important to say that the mechanisms are different. So this clotting issue associated with the vaccine is a very distinct syndrome. It's not just like the clotting that you get stepping off a plane or having surgery. It's what it's thought to be is due to the generation of an aberrant antibody due to the vaccine, and then that triggers platelet activation and clotting, and that's a very different mechanism to the clots that you get otherwise, which are quite different. So there's no reason to believe that ordinary clots, having had them before or having surgery or getting on a plane for that matter, would be a risk factor for this specific clotting syndrome.
So someone with a history of blood clotting is not at risk of...
Exactly, yep.
Professor Cheng, sorry, just to clarify on mask wearing outdoors, so we've heard there haven't been any cases of transmission outside, so I guess are we still wearing masks outside to safeguard against that potentially happening?
Yeah, so just make the point that there haven't been any outdoor transmissions in this outbreak, but there certainly have been before. And also the other point remains that it is quite hard to track transmissions that do occur outdoors, so we're probably not finding them perhaps as well. So transmissions certainly have occurred outdoor. They're not very common, but they do occur, and we're at this stage when there are active cases in the community, I think it's a small thing to ask for the community to continue to wear masks at all times when they're out of the home.
So there's a possibility people have picked up the virus outdoors, we just don't know about it?
So not so much in this outbreak, because we think we've tracked most of the transmissions that have occurred, but certainly in Victoria's second wave last year, there were a number of settings that were thought to be outdoor. Often it's very difficult to tell, their weddings, for example, can be outdoor weddings, but there's an indoor component to them. Things like that certainly have been documented as
purely
exposure
outdoor
sites.
transmission during the second wave. Do we have a rough estimate of how many?
I don't have an estimate. It's when I did ask the question last year, the answer that the public health team came up with was they thought that perhaps about 5%, which would be sort of in line with that sort of 20 times less risk. More risk with an indoor setting, but again, it can be very difficult to tell. Is it purely indoor, outdoor? Could it happen in the toilets and those sorts of things? Is very difficult to know.
And just based on the AstraZeneca question as well, when you made that distinction with the target on the age of 50, we obviously had no community transmission at that point. We didn't really have any cases at all at that point, and it was based on a risk profile. Given that we're better at treating it now as well, is there any? Could we potentially lower the age, or is it going to stay a hard 50?
Look, I think it's something that we look at all the time. We are probably picking. So there probably is quite a spectrum of this. So unfortunately, there has been a person that has died, but equally there are cases where they've had a fairly uncomplicated clot, spent a day or so in hospital, and then have been fine. What I suspect we're finding is some of those milder infections, milder cases, that probably would go undetected in other countries where their health systems are under stress. But it is a risk, and the risk actually is also determined by what is the risk of complications from COVID, which is clearly very strongly aged pattern. So for every decade of life, your risk of ending up in hospital or intensive care goes up by about threefold. So that inflection point is around that age of 50, and that's where the distinction has been made.
Thanks all.
Thank you.
Thanks, Alan.
Thank you.